Hello everyone, my name is Yogita Kotwani and my topic is Haematinics. The subtopics I will be covering are Haematinics basic considerations, iron, oral iron, parenteral iron and its uses. So first let's look at what basically is Haematinics. These are the substances which are required in formation of blood and are used for treatment of anemia. So anemia basically it occurs when there is an imbalance between production and destruction of RBC. So haematinics, these substances include iron, vitamin B, folic acid. Now though erythropoietin it is given as a medicine to increase the hemoglobin content of blood, but it is not classified as an haematinics since it is not considered as a nutrient but it is an hormone. A deficiency in these haematinic substances can lead to anemia. Now let's look at classification of haematinics. Haematinics it is classified as iron, maturation factors or adjuvant haematinics. Iron it can be oral iron or parenteral iron. Oral iron preparations are ferrous sulfate, ferrous fumarate, ferrous gluconate, etc. Parenteral iron preparations are iron dextrin, iron sorbitol, citric acid, etc. Maturation factors includes vitamin B12, folic acid. Adjuvant haematinics are copper, pyridoxine and riboflavin. Now let's look at iron. Distribution of iron in our body. Total body iron in an adult is 2.5 to 5 gram, which averages to about 3.5 gram. It is more in male, that is 50 mg per kg, than in female, that is 38 mg per kg. It is distributed into hemoglobin 62%, iron stores as ferritin and hemosiderin 25%, myoglobin 7%. Now iron it is stored in body in reticuloendothelial cell. It is stored in ferric form in combination with a large protein, that is apoferritin. Now daily requirement and dietary sources of iron. Daily requirement in an adult male is 0.5 to 1 mg. In an adult female that is menstruating it is 1 to 2 mg. In infants it is about 0.06 mg per kg. In children it is 0.025 mg per kg. Now the dietary sources of iron. These are liver, egg yolk, dry fruit, meat, chicken, milk and its products. Now absorption. So iron absorption basically occurs all over intestine, but majority of it occurs in the upper part. Now the dietary iron which we take, it is in two form, heme form or inorganic form. Absorption of heme iron is better as compared to inorganic form and it occurs with the help of a protein, that is heme carrier protein, HCP1. Now two separate iron transporter, that is DMT1 which is present at luminal membrane, that is divalent metal iron transporter, and ferroprotein that is present at basolateral membrane function to effect iron absorption. Now the factors which facilitate iron absorption are acid, reducing substances like ascorbic acid, amino acids and meat. Now the factors which inhibit iron absorption are alkalis, phosphate, phytates, tetracycline. Now these four substances they inhibit iron absorption by forming complexes with iron. Fifth is presence of other foods in stomach. Now fourth, transport, utilization, storage and excretion. So this image basically sums it up all, and the metabolism of iron is shown in this image. The iron which we take in diet, it is in two form, Fe2 plus or Fe3 plus. Now this Fe3 plus form of iron, it is transported into the lumen of intestine via two proteins, ferroprotein and DMT1, that is divalent metal iron transporter 1. Now the iron which is absorbed in the intestine in Fe3 plus form, it combines with ferritin to form apoferritin. Now this apoferritin it aggregates to form hemosiderin. So this is the metabolism of iron. Now preparation and doses. First, oral iron. Some simple oral iron preparations are: first, ferrous sulfate. It is the most cheapest and often leaves a metallic taste. Second, ferrous gluconate. It has 12% iron content. Third, ferrous fumarate, which has 33% iron content. Fourth, that is colloidal ferric hydroxide, which has 50% iron content. Fifth, that is carbonyl iron. Now let's look at adverse effects of oral iron. These include epigastric pain, heartburn, nausea, staining of teeth, metallic taste, bloating, etc. Now the next is parenteral iron. So parenteral iron therapy by injection is indicated only when oral iron is not tolerated or the side effects of oral iron are more. Second, failure to absorb iron. Third, non-compliance to oral iron. Fourth, in the presence of severe deficiency with chronic bleeding. Fifth, along with erythropoietin in chronic kidney disease. Now, for injecting parenteral iron, there is requirement for calculation of iron requirement. Now, iron requirement can be calculated by a simple formula, that is 4.4 into body weight into kg into hemoglobin deficit in gram per dl. Now, first parenteral iron preparation will be seen are iron dextrin. Iron dextrin, it contains 50 mg elemental iron per ml, and it is the only preparation that can be injected both intramuscularly as well as intravenously. Now, via intramuscular route, when we inject in muscle, 10 to 30% of the dose remains locally bound and becomes unavailable for utilization for several weeks. Therefore, 25% extra needs to be added to the calculated dose. Now, since dextrin it is antigenic, anaphylatic reactions are quite common with iron dextrin. Now, the adverse effect of iron dextrin are local effects like pain at the site of intramuscular injection, pigmentation, etc. Systemic adverse effects are fever, headache, joint pain, flushing, etc. Now, the next is ferrous sucrose. Ferrous sucrose, it is safer than the oral iron dextrin, and a dose of 100 mg, maximum up to 200 mg, can be injected intravenously, taking 5 minutes once daily to once weekly till the total calculated dose is administered. However, total dose intravenous infusion is not possible. Now, since the solution is highly alkaline, it rules out intramuscular and subcutaneous injection. Now, ferrous sucrose, it is particularly indicated for anemia in kidney disease patients. Now, oral iron should not be given concurrently until 5 days after the last injection. Now, the third is iron isomaltoside. It is latest injectable iron formulation for intravenous use. It is marketed in India in 2016. Now, high single dose of 1 to 2 gram intravenously over 15 to 30 minutes can be administered. Thus, full iron deficit can be corrected by a single short period intravenous infusion. Now, the side effects which are reported with this are nausea, epigastric pain, abdominal cramps, constipation, loose motion. Now, ferric carboxymaltose and iron isomaltoside are two most convenient and safest intravascular iron formulations. Now, let's look at uses of these iron preparations. It has two uses. It is used in iron deficiency anemia and megaloblastic anemia. So, iron deficiency anemia, it is like one of the most common anemia which occurs in developing countries like India. Here, first the cause of iron deficiency need to be found out, and then iron should be normally administered orally. Parenteral therapy is to be reserved for special circumstances only. A rise in hemoglobin level by 0.5 to 1 gram per dl per week is an optimum response to iron therapy. The second is megaloblastic anemia, which occurs due to deficiency of vitamin B12 or folic acid. So that's all about my topic. Now let's look at some MCQs. First, absorption of oral iron preparations can be facilitated by co-administering. Options: antacid, tetracycline, phosphate, ascorbic acid. So the answer to this is ascorbic acid, as it saw it in one of the factors which facilitate iron absorption. Second, the iron stored in intestinal mucosal cells is complex 2. Ferritin, intrinsic factor, transcobalamin or transferrin. So the answer is ferritin. Third, the preparation of elemental iron in hydrated ferrous sulfate is options 5%, 10%, 20% or 33%. So the answer is 20%. Now fourth, patient receiving iron therapy should be warned about. First, dizziness, ringing in ears, danger of sunlight, blackening of the stool or paresthesia. So the answer is blackening of the stool. Fifth, the side effects which primarily limits acceptability of oral iron therapy is epigastric pain and bowel upset, black stools, staining of teeth, metallic taste. So the answer is A, that is epigastric pain and bowel upset. So that's all about my topic. Thank you.